is very welcome my boss, Stuart Su, and me, Polly Tan, to come here to to Philippines. Thank you so much for your welcome. So, and of course, thank you so much for your coming to attend our product training for today. So it is our pleasure to come here to share our our knowledge and whatever we can with you guys, and hope that you can get whatever you want. Okay?
Yes.
If got anything is not understand, or maybe you want me to get slower, you can stop me and then ask me to be slower a bit. Try to understand whatever the product is, and that this is very important for you guys. If you want to sell the things, you have to understand the products before you sell.
Yes.
Right? Okay. So, all right. Maybe we don't delay the times since it is quite late. So maybe we start off with the products. Okay. As you know, thank you. All right. So today the products that we are going to introduce to you guys is the Bone-M. So Bone-M is a patented product, is patent pending. So we filed in the patent and we are still waiting for the patents to come up. So it is a joint beverage. It is in a powder form, but you can mix in any beverage to become a very healthy and also tasteful beverage. Okay? So mainly the Bone-M we target for the joint health. So you know what is the osteoarthritis? Maybe you are familiar with that, because you know that is a kind of the arthritis disease. So maybe let us go for some introductions on the arthritis. The meaning of arthro actually is the joint. Itis meaning is the inflammation. So if we combine the things in the layman term, we call it as joint inflammation. Okay? So it is the arthritis actually, not only osteoarthritis is considered as arthritis. Actually, there has about 100 plus of the related conditions. Not only osteoarthritis, bear in mind, okay? So arthritis consists of more than 100 different conditions. Like the rheumatoid arthritis is considered a kind of arthritis disease. And also the pain syndrome, it includes the pain syndrome caused by the rheumatoid arthritis. And also we have the osteoporosis. Okay, osteoporosis mainly about 70 to 80% it happens on female. So we have to take care. We have to intake more collagen and more Bone-M definitely to prevent the osteoporosis. And also the gout and the similar symptoms, like when this is the starting stage of the arthritis, like sore, stiff, inflamed, and your painful joint. Okay? So what happened to the osteoarthritis actually is it can cause the osteoarthritis in the few places. This is the main place. Like the spine, the spine is the main. The main. How to say? It's the main bone of our body. So we have to take care of the things because the spine inside contains a lot of cartilage. So cartilage is the main. The collagen is where the collagen form. Okay, and the knee, of course, and your foot, and hand, and your hip. Those are the joint. Those are the parts that has a lot of joint. That is very important. You have to take care because the joint inflammation is caused by the cartilage. Is damaged. Okay, maybe we go further for the further slides. So what caused the things, the osteoarthritis? What caused the arthritis? What caused the joint inflammations? Actually, is due to our daily activities. Like we have to walk, we have to run, maybe, and we got a lot of daily activities that we have to do. Like just now, maybe we walk for 3 kilometers, so maybe we have to intake more Bone-M to keep ourselves in a good conditions, especially it's good for our joint. And also, those are the daily activities, like girls like to go to shopping. Definitely, we think that is not a problem. We just shop for 8 hours, it's okay.
8
But
hours.
you will know the effect when the times is coming. Okay? And of course, for our modern lifestyle, we like to eat a very meaty meal, a lot of meat. Every day we need a meat set, and then definitely here you like the pork, right? So these are maybe can cause the future joint inflammations and also the future arthritis disease. So, and those carbonated drinks, and also your lifestyle, like maybe you have to sit whole day in front of the computer, or maybe you like to play games in front of the computer for the whole about 8 hours. So that is also a problem. So, and we can see that when the age is increased, the bone age definitely will increase as well. Because this is the degenerative disease, the arthritis. So when your bone age is increased, so you can see your bone will start to degrade because of the damaged cartilage. So according to some studies, the peak of the bone age actually is the 30. So mostly here I think it's still under 30.
Yeah, come on.
So you better take care once you reach 30, okay? So it will decline at the rate of 0.5 to 1% per year. Okay, so the next one, maybe we try to have a small quiz. Can anyone answer me how many bones in human body? Sorry? 206. Good. Is there any present for him? Do you have any present? Yeah, Bone-M, one box. Okay. I want to ask from Longrich.
Wow.
Okay, thank you so much for your answer. Yeah, it's 206. So, okay, now we are looking at the joint. What is the joint? Just like I mentioned just now, that is the connections of two bones. That is the joint. So from there you can see, okay, this is the normal joint. It consists the muscle and the tendon. And these are the synovial fluids. And of course, between the joint and the bones actually are the cartilage. So like just now I mentioned, cartilage is the collagen. Okay? Yeah. So, okay. Oh, there is another quiz. How many joints in human? You really go to count it? Okay. 50. More. You need more joints to build up your body.
100.
200. You don't have that much joint. Let's say, okay, now I will tell you the answer. That is 143. Yeah, we have 143 joints in our body. So that means you have to take 143 packs of Bone-M per day. No, just kidding. Okay, so you can see that is the difference between the normal cartilage and the damaged cartilage. Just like what I mentioned just now, the arthritis or the damaged cartilage is the degenerative disease. When your age is increasing, definitely this is cannot avoid. So this is a fact. We have to admit the things, but we can prevent. Okay? So cartilage, this normal cartilage, actually like the cartilage is the soft tissue layer on either side of the joint that cushions the ends of the bones. When the cartilage is damaged, it it can cause the painful, the inflammations, and the swelling, and also can reduce your mobility. Okay? Yeah. So these are the 4 stages of the arthritis. The early stage, you can see, is the healthy cartilage. Maybe that is during our teenagers times. And when we are growing up in the middle age, for the stage 1 and stage 2, you can see the cartilage begins to wear out. Yeah? Alright, and the last stage, actually we can see the stage 3 to stage 4. Maybe is after 30 or 40 or maybe more. You can see the weak cartilage and the bone started to shift. Okay? Yeah, definitely all I introduced today here is the beginning of the disease if we didn't take care very good. Okay? So if we not treated promptly, we not treated it now, so the results may impair for your mobility for your life. So extremely pain, there is definitely the symptom, one of the symptoms, and it can happen regardless of the race, age, gender, and time, and definitely regardless nationality. So Malaysian need it, Filipinos also need it. Okay? So do you know what is the knee pressure experienced by the people who have weight 70 kilo?
Oh.
If you lie down, do you have any knee pressure? No. Yep. You don't have the pressure on your knee when you are lying down. But if you are running, you have 4 times of the knee pressures on your joints. Okay? That is 4 times is about
Wow.
280 kg. Just you imagine, 280 kg, that means four people of 70 kg weight is on your knee. It's sitting on your knee. That is so painful. Yep. And also when you're going up the stairs, that is also about 4 times 280 kg. Or maybe you do some layup. You like to play basketball, the layup. It has 6 times
Wow.
of your weight, of the 70 kg weight. Yeah. Or maybe you squat down, that is even more. 8 times. You don't think that, oh, I just squat it down and then I can get it up very fast, so I'm so healthy. Yeah, now you are still healthy because all of you are still under 30. But if you're above 30, then you will know what is the problem. Okay? Yeah. So for the next one, actually, we want to introduce there is a solution. There is a prevention. Always remember, prevention is better than cure.
Yes.
So you have to prevent. There is a solution for you for your damaged joints. There is the patent pending Bone-M. Okay? Yeah. We can see here, actually Bone-M, we emphasize on the quality. We have to standardize the quality. We cannot, every batch is different quality. No, definitely that is not our concept. We have to maintain the quality. We have the certifications from our Malaysia government. Bionexus status is for a biotechnology company. We are the Bionexus status company. So this is recognized by our Malaysia government. And the technology for the products is from the German. And also we have the GMP certifications. We got the HACCP, and actually we have the ISO 22K that is lacking here.
Wow.
Okay, and this product is tested. We have the certificate of analysis. Okay, and that is definitely, this is a steroid-free products. We didn't put any steroid. Okay, and it is natural to rebuild your cartilage.
Yeah.
Okay. So these 5 are the main benefits of Bone-M. The first one, anti-inflammatory and the analgesics, and to rebuild your cartilage. And the third one is to increase your calcium absorption and helps to for your intestinal peristalsis and also suitable for diabetic patient.
Oh.
Yes. Okay, so we will go one by one for the benefits. Okay? Yeah, the first one, the anti-inflammatory and the analgesics, actually is because of the mangosteen. The mangosteen has about, I think, more than 100 and more than 1,000 of studies on mangosteen. Even though myself, my PhD, actually I'm studying in the PhD for the mangosteen. So I'm doing the research for the mangosteen. So I know what is the benefit of the mangosteen. We pick up only one benefit, that is the anti-inflammatory, because that is good for our joint inflammations. We have to take care of the inflammation before we go further for other benefits. Okay? So mangosteen, known as the queen of fruits, maybe you know that. And okay, we have our own plantation. We control the quality that the mangosteen that we pick up. Okay? And the mangosteen extract contains a lot of bioactive compounds. The major are the mangosteens, the alpha, beta, and gamma mangosteen. Those are the xanthons, and the helps in the anti-inflammatory properties and also an antioxidant. Okay? So what really causes heart disease? This is what we say is heart disease, but actually a lot of diseases is caused by inflammation. Yes, you can see the cancer, the Alzheimer's, the cardiovascular disease, diabetics, autoimmune system, even the arthritis definitely, and neurological disease and pulmonary disease actually also caused by the inflammation. Yeah. These are the details of the chronic inflammations, like just now I mentioned, the all stages of the cancer and also neurological like Alzheimer's, depressions, also caused by the inflammations. Okay, and definitely we only focus on this point, that is the bone and joint disease, osteoarthritis, RA, rheumatoid arthritis, osteoporosis, and the osteopenia. So this is the Bone-M target. Okay? And just now, like I emphasized, we got a lot of studies on the mangosteen extracts. And of course, these are the few that I pick up. And the major, like mangosteen extract, it has a very, very high antioxidant.
Wow.
We tested it in the NUS, the National University of Singapore. We tested in Malaysia, a lot of university. We have a lot of testing, and also we have anti-cancer. Actually, there has several studies. Okay, and those I think maybe we go through once: arteriosclerosis, cardiovascular, neuroprotective. These are the major that mangosteen extract can help in. Okay, and this is the clinical study that we have done with one of the research center together, and then we are doing the induced inflammations on the rat's paw. Okay, we induce the inflammations, and we compare the things with the dichlorphenate drugs. This is anti-inflammatory drugs. So and these drugs we put it as a control together with our mangosteen extract, and you can see the results. The very obvious is here.
Yeah.
After 10 days, our mangosteen extract reduced very fast the inflammations.
Wow.
Yeah, comparing to drugs. And one thing you have to bear in mind, the drugs, it has the side effect.
Yes.
Yes, it can cause, kidney failure and maybe liver failure. Yeah. So that means we are using the mangosteen extract because it is natural and it is safe. We did the toxicity test on the mangosteen extract as well. Okay, so we are comparing between the mangosteen extract in Bone-M and another brand. Actually, this is a brand, a quite well-known brand in Philippines. Okay, we bought it and then we tried to do some comparisons between these two brands. So you can see the difference is the sediment. It has the sediment after we try to dissolve the things. So, and also the powder takes time to dissolve. But the mangosteen extracts in Bone-M, it doesn't have any sediment.
Wow.
Actually, I can do some live testimonial here. I bring the mangosteen extract, and then later we can do some experiment, and you can see the extract powder dissolve very fast. Okay. So these are the comparisons also between the two brands, our mangosteen extract and also brand X. This is before, and after 10 minutes, you can see the sediment is down there. But with our mangosteen extract, it doesn't have any sediment. And we try to pour out the liquid. Yeah, you can see, very obvious. Okay? Why it has the sediment, but our mangosteen extract don't have? This is the reason. Bone-M, the mangosteen extract in the Bone-M, we did some extraction. That is water extraction, and it is water soluble. And you can see the results here. And the major difference between brand X and the Bone-M mangosteen extract is they are using just a blender to grind the skin. Yes. So this is the skin powder. It is not an extract. Yeah. So it is not water soluble. This is the main reason. Okay. Yeah. So after the inflammations, we want to rebuild the cartilage. Now we are using the collagen hydrolysed, vitamin C, and mango to rebuild our cartilage. So after you taking the inflammations, you take care of the inflammations, try to reduce your painful swelling and redness. After that, you are to rebuild out your cartilage and your collagen. So benefits of Bone-M, definitely, as you know, it is a very high antioxidant. Why? Inside it has the mangosteen extract, and it is a proprietary extraction technology. So the technology is developed by us. We are the control. We are the manufacturer. So the German technology for the collagen, we have the patent pending formulation, and of course the collagen with the 3000 Dalton molecular size, it can absorb to our body. If the higher, no. So we have to control on the molecular size of the collagen as well. And also easy for us to absorb to our skin, to our body, to our bloodstream. Okay? Yeah, the mechanism of collagen hydrolyzed. So after drinking, your collagen hydrolyzed will absorb into the intestinal wall. And then it will transfer to the bone and also the cartilage tissue. And it helps to stimulate the formation of your cartilage. That is the main mechanisms of our collagen hydrolyzed, the mechanism of action. And also we put in the vitamin C. It is a water-soluble vitamin that is recognized as ascorbic acid. That is their scientific name. So in the human body, your vitamin C is responsible for stimulate and developing your collagen in bones, in your cartilage, in your muscles, and also for your blood vessels. Okay, so we put in the mango as well, besides the taste, but it has a lot of benefits. Rich in phytochemical. Okay, and mango is the best source for beta-carotene, and also vitamin C and copper. These are the bioactive inside the mango, and it helps in for the phytochemicals properties. So there is some studies from the Institute of Food Science and Biotechnology in Germany found that the compounds extracted from mango that has the ability and is a very potent anti-inflammatory properties. So we put in the inulin that helps in the intestinal peristalsis. Why we need the inulin? So inulin is the dietary fiber. Definitely, if you want something, the nutrients to be absorbed into our body, actually we need to flush out the excess toxin or excess things in our body. So the inulin is the main ingredients that can help to flush out the toxin. It's a dietary fiber, so it helps us to the peristalsis, your gastrointestinal to work. Okay, so yeah, you can see there is some studies saying that the adolescence has improved the calcium absorption and bone mineralizations by using the inulin, that is the prebiotic. Okay, and of course it can improve the bowel movement, so it helps in your gastrointestinal problems. Okay, and after you clean up the excess toxin, only then you can absorb the calcium, only then you can absorb the collagen. So now we are putting in the calcium lactate for you to absorb. So 99% of your in your body calcium is stored in bones and teeth. So because of the storage, when your body needs, your calcium will take from your body to use in many places. Okay, but if your calcium is not enough, so definitely your bones will become weak. Okay? And just now I mentioned it is suitable for diabetic patients because we are using stevia. Okay? We are not using sugar or any glucose. We are using stevia. So, who need Bone-M? Everyone. Yeah, I know you need it. Everyone need Bone-M. Elderly people, they need it. Obesity, we need it. And also, yeah, ladies who likes to wear high heel, definitely you need it. Okay, or maybe you have the serious injury on your joint, or your working environment need to move a lot of things, and then you need the Bone-M, where you need to eat at least 1 packet a day. Okay? If you feel that, okay, after that I already okay, and then do I still need to eat? Definitely you need to maintain. Like I say, your bone will degenerate by your age increasing. Okay? So very easy. You want to you want to have Bone-M. Yeah, before meals, we prefer to take 20 minutes before meal. Okay? And then you try to pour 1 sachet into 150 ml of warm water, or maybe the water at the room temperature, and you stir well and drink it. So patients with joints or bones problems, maybe you can increase the dosage to 2 sachets per day. Okay, so for long-term consumptions, you can see the results actually delay in the aging because it has the antioxidant properties and helps you beautiful and young.
Come on.
Yeah. Okay, so very fast. That's all for my presentation, but maybe I can do some demo experiment for you.
Extract is inside Bone-M.
We just put it in the capsule. Actually, it's the same extract. Okay, so yeah, you can see the dissolutions of the extract in the water. Even though we didn't do any stirring, but then you still can see it dissolve very fast because it is water-soluble extract.
Wow. Wow, amazing. Come on.
This is what they call biotechnology.
Wow.
So if you want to make it fully dissolved, just do a simple stir.
Oh, dissolves now.
So that's why we emphasize on the things we are using extract. We are not using powder. So it is the skin extract, it's not the skin powder.
Wow.
Amazing.
Great, amazing.